Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Hannah Lowe. Thank you so much for being here, Hannah.
Oh, thanks so much for having me. I'm really excited to speak with you today, Brandy.
Let's start by introducing yourself to the audience.
All right. Well, I'm Hannah. As Brandy has said, I am a mom. I am a professional. I'm a friend. My day job is working as the director of advanced practice operations at a startup. And I love that world and feel grateful to work with patients and with colleagues every day. And I'm located in Alabama, so startup has given me a little bit more flexibility than my typical geographical options. And that's a little bit about me, Brandy.
Well, I would definitely want to dig into startup life because I feel like so much of my audience is interested in that. But one thing I want to say that I love about your intro is how you identified yourself first as a mom and as a friend, right? And sometimes as healthcare professionals, we become our job and our license. And so I am inspired by how you started your introduction.
Well, thank you. I think there's so much about people that we don't know, right? Because we see them, we're spending 40 or 50 hours or more in a professional setting. And some of the best advice I've been given as I've grown as a leader and as a professional and as a person is just like, do you really know and care deeply about people? And I think, yes, there are hard days because no one is perfect. But I love to know more about people and who they are, because people are so important, more than just exactly to your point, how many years we went to school, how many boards we've had to pass. And it's easy to get wrapped up in that. I know that's why I sometimes intentionally start out, because my other, dinner party trick is to say, this is who I am, and I'm trying to be more grounded. That's a goal for 2024.
Well, I love that because, our professional identities, just from how we learn in school, is so wrapped up in that thing that it makes it hard to leave that thing because it becomes a part of who we are. And that's something that I have to catch myself with too. When someone says, what do you do? Or, what do you do for a living? Oh, I'm a physical therapist. Well, I haven't practiced physical therapy as a clinician in a long time. But that's still a part of what I identify. I'm working on being okay with who I am outside of that.
Yes. Yeah, it's such a journey, right? And I think there's something to it. I was in leadership coaching for quite some time. I'm on what I like to call a sabbatical because I don't think there's ever, for me, a beginning and an end necessarily anymore because it was so influential. Mm-hmm. And one of the most key lessons that Rob, my coach, would look at is really like the 5 points of life. Mm-hmm. We would really graph through like, how are you spiritually? How are you at work? Like, how is your, significant other or partner? How is your friend group? And how are you feeling financially? And he would always say, when those things get out of balance, we're going to start having a problem. And I was so prideful at the time. I was like, I don't have a problem. And I can tell you, first quarter of 2024 has been a problem. And I recognize that. But I've loved using that tool because I think no matter where you're at in life, and what you're trying to decide, it's a really rich moment to also have to reflect, right? Because there's so much intentionality in balancing who you are as a whole person, not as just one segment. And it's a challenge, but it's a good challenge, I think.
Yeah, we are multidimensional for sure. So what is your clinical background? How did you start out in the clinical world?
Sure. So like every good 18-year-old that thinks they have the world by the tail, I actually had planned to become a home economics teacher.
Wow. Okay.
Yeah, it's kind of funny now. I mean, it's a wonderful thing. I loved sewing, I loved cooking. And I actually did a project. I was a huge chemistry nerd in high school and did a project on nutrition and dietetics. And I kind of pivoted. I ended up choosing a really small school initially to study home ec in. And where I'm going with this is I quickly learned that I did not want to be a home ec teacher. No offense to home ec teachers, but I really liked biochemistry and nutrition. So I ended up transferring to the University of Tennessee and completing a degree in nutrition and hotel restaurant management, which has actually served me really well in healthcare, the minor in hotel restaurant and tourism. But I became a dietitian out of college. I did a dietetic internship in Dallas, and my initial work was in Appalachian, Virginia, as an inpatient, outpatient dietitian at a very small hospital, truly in the heart of Coalfield world, and near the Virginia Creeper Trail. And at that location, I had this moment where I was like, I love dietetics, I love biochemistry, but I'm not touching patients. I'm writing orders or counseling them on nutrition. I'm not as fully interactive as I feel like I'm made to be. And a little bit of that background is my mom was a nurse, and I call her somewhat of a parish nurse. She did a lot of outpatient, but she was also in our local community a nurse. And I think looking back, I was somewhat rebellious, and I was like, I would never be a nurse like my mother, so I'll be a dietitian. And then within that first 2 years of being a dietitian, I was like, I think I'm going to either go back to medical school or nursing school, and ended up going to a direct entry nursing program, which gets a lot of flack, but also produces a lot of leaders, to be honest, essentially meaning I completed my RN and then proceeded right into my master's. And so I became a family nurse practitioner. I've kept my dietetics certificate. And then I'm also a diabetes educator by training. So my clinical journey is a little bit non-traditional. And then I finished the doctorate right at the end of the pandemic in nursing, really to publish and do leadership in a way for me that was meaningful. So, so my journey has certainly been, yes, academic. Like I love going to school. This is the longest I've not been in school, I think, since I was pre-kindergarten, because I just kept going back. And my clinical experience has really been, I worked in federally qualified health as my first job out of my master's in nursing, and was a Nurse Corps scholar recipient. And that was an incredibly rich experience. I worked as a nurse practitioner in retail health, which was, it grew me and prepared me really well for what I do now in startup, which is, yes, there's a clinical component, but at that time in that retail health establishment, we were very performance driven, and it really taught me, like I marketed to a mushroom factory and they became one of our clients. Like there were just things that I did that were like random, but really have paid dividends in a sense, and I enjoyed them. So my background's a little bit of a winding road, and I'm very happy and grateful to be a practicing dietitian and nurse practitioner, and love a good challenge. So that's the long story of my winding road there.
Now that's really good. I have an interesting question for you, and this is because I really don't know the answer to it. So you have your master's in nursing, right?
Yes.
And you have your doctorate of nursing practice.
Correct.
And you have your nurse practitioner.
Yeah.
What's the difference between those three?
Well, a few things. One, you can have a master's or a doctorate in nursing easily from being a nurse practitioner. Like basically you can be a nurse practitioner at a master's level of training where you're doing so many clinical hours, like all the other certified disciplines on top of your RN. And then people can have a doctorate of nursing practice and not be a nurse practitioner or, a nurse anesthetist or something like that. So a lot of it is, some of it's purely academic, and then the NP certification is additional clinical hours and clinical training and expertise outside of the master's and doctorate. So probably the biggest differentiator is, I think, nurse practitioners got to a point where they saw physical therapy, occupational therapy, some dietitians, a lot of professions were heading toward a professional doctorate, and there was kind of this leveling up thing. So really, most people that are nurse practitioners have a master's level degree. They've tried to push going to the doctorate. It's not completely had great uptake from what I can tell. And my personal reasoning for all of this was you had to have the master's to become a nurse practitioner. And then I really thought I would be in academia doing bench research or collaborations. And I have not gotten there yet. Doesn't mean I won't, but that's the best differentiation between all those letters and all those degrees, I think.
Okay. And how did you get into startup life? What is that like? Because I have a lot of people in my audience who are considering going to healthcare startup and have no idea what they may be getting into or even where to start.
Sure. I love that question because I never woke up one day and thought I am going to start up, which I feel like is like good and bad. Good in the sense that I naively joined a startup. Honestly, I had a journey to have my daughter, and I was working PRN during COVID while I was pregnant. I was working at an on-site health clinic that I loved it. It was an incredible opportunity. But as with all good things, COVID really changed that. And so my time to deliver my daughter comes, my job dissolves, and I think, okay, I'm not really ready to go back to honestly 9 to 5 clinic life. And
right.
I'm incredibly introspective. So I had kind of been learning through my like years of experience that I did not I did not always fit the typical nurse practitioner that was thrilled about seeing patients from 9 to 5. Like after a while, I've always kind of looked for the next thing, be it good or be it bad, that's my personality. So my daughter Helen comes along. I've been home 3 months and I'm thinking, I don't think I'm meant to be home full time. How about something in telehealth? So that began my quest for applying on LinkedIn for telehealth jobs. And my position that I applied for really was just like a random like diabetes expert. And they needed the state licensure I had. They wanted an NP to work with this chief medical officer. So I didn't really know, Brandy, like what I was doing. And I spoke with the chief medical officer and someone who's deeply involved in operations. And I was like, I'll give this a try. If it's a flop at 6 months, like no harm, no foul, something will open up. The pandemic will dissipate. And it has been really a roller coaster ever since. Startup is what I tell people. I cannot imagine not doing startup. Like I deeply care about it. It's incredible to show up to work not knowing what the day will bring or having the ability to make a big, what feels like a sweeping change, like an improvement. So a lot of the things that frustrated me about usual healthcare, the monotony, are the exact opposite. Like you kind of buckle in and say, okay, what is going to change this week? Who is going to change this week? And that sort of thing. So I was not as intentional in my like, I'm going to work for a startup as I was intentional about integrating the things that I loved in my work with a way that worked for my family. And that was my startup point.
Yeah, what really stood out to me about what you said was the fact that you knew that if I did this and didn't like it, it was okay. And I think a lot of times when clinicians are looking for new roles, they think that, if I make the wrong decision, oh my gosh, what's that going to mean? But not really thinking that if you make the wrong decision, you learn from it and it's not permanent. You can do something different.
Yeah, I think that's key because there's all of this buildup, right? Like we go to school and we have this structure and we get out many times. And there's something about it that perhaps does not align with what we thought it would be. And then we're faced with this sort of like weights and measures. And I think there is freedom in saying, this isn't working. I don't know if I'm going to step into this box for a minute. Startup has really freed me in some sense from that. So I have been in my current position almost 3.5 years. And like, I'm becoming like a veteran in the company because startup also seems the turnover and the new opportunity, especially just after the pandemic, we're in a little bit of a interesting market right now. I think it will resolve itself, but it's almost more accepting than, to me, at least the traditional clinical roles that I had seen where someone might work in the so-and-so clinic for 25 years. Like, it's not uncommon for someone to leave a startup within 12 to 18 months. And tenure is both a gift and it gets really hard. So I think that there can be some freedom. And I'll tell you, many days startup is hard. And you think, okay, I do this little test with myself, Brandy. I'll think to myself, okay, am I at a point where it's time for me to go back to urgent care? Do I want to go back and try to establish a panel in a federally qualified health center? Like, I do a personal test too to think, like, am I still growing? Am I still learning? And there can be freedom in that too. So it's almost like, for me, I think because of how I quote unquote put time in, which can also be super toxic, and I don't hold on to that, I reserve the ability and the freedom to say, you know what, I am going to go back and work in clinic, or, you know, I would like to go work for Omnipod and be a pump trainer. There's some kind of freedom after you take the first step of saying it's okay to try new things that I think does give you freedom in the future to continue with that as well.
That's really, really good, Hannah. The biggest mistake I see clinicians make when transitioning away from direct patient care is applying for every available role. Problem is, it's like throwing darts at a board, hoping something sticks. And let's be real, employers can sniff this out like a canine, and it makes the candidate come off as unfocused. The solution, my friend? Do some deep introspective work to identify your passions, skills, and strengths, and find roles that align with that. That's why I've partnered with Career Clinic, who created the healthcare career profile that I wish I had created first. It's called Stream Ahead, and it takes about 10 minutes to complete. It is time well spent to get detailed report of the top work streams that fit who you are. I'll link the assessment in the show notes section of this podcast. And you can use the code BRANDY10, that's BRANDY10 for 10% off. Now let's get back to today's episode. What is the hardest thing about startup or being in a startup? Because I think, from my perspective of having not worked in startup, but watching Shark Tank, if that means anything, is the potential instability with the series funding, and you're growing something from the ground up, so you don't know what it's going to look like yet. So there's a lot of friction there, I would imagine, at the beginning.
Oh, there is so much, like, that is so real. I'm going to do my best to answer the hardest thing, but I think that there are so many things that can be really hard. So probably the hardest thing is that the ball is always moving. And it is both so stimulating to think, like, it doesn't have to be this way, like we can make a change, but it can be so exhausting. And I think that the hardest thing is, with that ball moving, grounding yourself and saying, this is my passion. I care about this, but I care about my health too. Because you'll see there's a lot of heroicism in startup, and that works for a while when you're meeting a deadline. Or I've been through 2 rounds of funding. So I've been on that, like, burning the midnight oil to make sure everything is there, because diligence is its own special subject that I'm still not fully read into, but I've been a part of. So I would say the greatest struggle is maintaining honestly who you are and figuring out the balance, because the environment does not lend itself to boundaries.
That's a good call out right there. And so if someone is listening to this thinking, oh, I'm a boundary person, I need boundaries, then maybe startup's not for them.
So I think that's so key. I've been doing a lot of deep thinking, because I will be transparent that I have put up some new boundaries. And in fact, I think they've made my career grow. So, and someone actually privately reached out to me when I shared a little bit about expectations. I think that boundaried people can still enter startup. One of the best things I've learned is you meet so many people. And I mean, I've worked in environments, and I've been at, major universities, like many of your listeners. And so startup is rich especially early stage, because you meet all these people and you're all together with this one goal. And it's different than the hospital, different than the clinic. And I've also learned from my colleagues that have moved on. Like, one of them told me that they were only working like 30 hours a week. Like, they were working for a particular European company that's fairly well known. And they were like, oh, yeah, we leave early on Friday. Like, so I don't think it has to be. I think boundaried, structured people can still very well fit in. I think, in fact, boundaried, structured people can drive change and can really encourage a balance when heroic efforts get too high.
So what advice would you give someone who was thinking that they might want to work in a startup because maybe they want to work remotely, or maybe they want a challenge, or maybe they just want to do something different? What advice would you give them?
I would say taking the leap is the right thing. And so anytime I think about someone joining, because I've done hundreds of interviews for my company, for both the team that I direct and then for other groups, is, a couple of things. Part one is those initial interviews or those initial applications. Don't be afraid to reach out to somebody who works there. One of my favorite things that I actually see is when people LinkedIn me, and I will often have a 15-minute conversation with them, just saying, like, here's where we're at, So I think, first of all, not being afraid to apply or find someone who will talk to you about the environment, because I think that can be part of it. I think being willing to take it, one thing I have seen, Brandy, is that I have had a little bit of interaction with all types of people in startup. And so even the most structured, like guideline-based folks benefit from working in startup, even if it is not for them. And I think it's worth taking that plunge. And most of them have many times, we have had very minimal turnover where I'm at for the most part, but I think back to instances where someone needed to try it, get their feet wet and understand, and that made them ready for their next adventure. And that was really helpful. So I think sometimes it's A, deciding to take the risk, and B, doing research, because the companies are much like people. They're all different. Some of them want to grow to millions of users in a short time. Others, especially the more I've talked to founders and networked, some people are really on a marathon path. And so that makes how they interact and how they staff and how they perceive their business very differently. And so this is kind of circumventing, but I would say being willing to take the risk is important. And you mentioned funding earlier, which I wanted to hit on. I do think early in this game for me, I was giving an award from my master's program to an alum, and she had successfully started a fairly major startup. And I networked with her after and have maintained a really amazing relationship, and very grateful to her. And she said, Hannah, like, are you sure you want to ride these waves? Like, financially prepare yourself that these things come and go. And I never want to be scary or daunting to people. I think it's just important to know, like, for me, I've thought, okay, if I am a part of a reduction in force, what would I do? Like, what margin am I living under? And then am I okay with going back to clinic for a bit? Like, so I would also say that, like I said, it's the highest of highs and the lowest of lows.
Keep your license in case you need to go back.
Yeah, but I still practice currently. I see patients. So, yep.
Well, I'm so glad you said that about taking risks and the funding part. And if you're able to share, I have a question. If you're not, that's okay too. But for people who are looking into going into a startup, how do they, and they're pitching themselves to a startup company about the value they add and all of that, how do they put a monetary value on that? So the startup says, okay, well, what are you looking to get paid? Or, this is what we're offering. How do they know if the offer is good? How do they know how to put a value on their expertise at a company that's a startup?
Oh, yeah. Well, this is the golden question. I'm happy to lend what I know, and I'm also happy to lend what I don't know, and be honest about it. So in the nurse practitioner world, at least, I do salary comps. So if I ever am pitching, like, or someone comes to me individually asking for advice, I give them very, like, what are you making in your local area? What are your comps? So for me, I do a lot of comp looking for who I'm bringing.
Mm-hmm.
And then if I'm positioning myself or helping someone else position themselves for a new role, I am very wise, as much as I can be, about equity versus money. And this is an area that I think clinical people need more help in, because no one gives you equity at the
Right.
hospital. So here you are, and they'll be like, oh, you're getting 400 shares and your salary is going to be 50% of the hospital. No. So you kind of got to know, like, first of all, you have to go in there confident, Brandy, like, I'm bringing this. I'm Hannah. I mean, I marketed and used to win mushroom factories over to a major retail health company. Like, you go in with this like true, like, I've done this. This is my track record. Here I am clinically. And do not, unless you know so much about equity, let anyone sucker you into a sub-optimal salary, because you should be paid what you're paid in clinic to me, unless you feel really good about the equity. And from what I'm seeing, at least in the clinical world right now, a lot of postings, especially the number of states that are required to post the salary, they're now starting to put like, here's your salary. We can negotiate between cash and equity. And there are some great resources out there to understand equity. So that would be my advice: is do not walk in there knowing that you are bringing all kinds of things, like not just Hannah RN, who's done all these things, and ensure that you feel like you're being honored as a person, as a professional. And no, they have money. No. That's it's my outspoken view.
I love that. Thank you so much for your transparency with that, because I do hear that, buzzing around in terms of equity, but equity is not guaranteed, whereas my salary is, at least for the time that I'm working there, unless there's like a reduction in force, like you're saying. So you don't know where the company's going to go. So if they're only offering you equity, then that might not be worth your time, maybe.
So I look at this a couple ways, and I've not been very true to myself. Equity is super fleeting, and equity sounds very sweet at the surface, but there are so many things, Brandy. I'm not going to go into all of them, and I'm not the expert, but like, you have to understand your vesting. You have to understand the cliff. Like, for me to have ever gotten the full equity in my company that I've been at and have promoted at, I think I have to be there 6 years. Yeah, there's a 1-year cliff,
Wow.
quote unquote, that you're essentially working and not realizing. And then it starts accumulating. And should I leave before the 6 years, I would still have to purchase the shares that would not be prorated or given to me. So the long game is important if you're into equity, at least from what I am seeing. And there's lots of ways. There's tons of posts out there and advisement, but it's complex. So that's the thing. Like, some people will join in some sort of quote unquote fractional role, like, oh, I'm going to be an advisor, I'll take shares of equity. That's fine. But like, if you're going all in and they're like, your only salary is equity, no.
Yeah, especially like you said, if you don't get if you don't even realize the equity for several years, right?
Oh yeah.
And you've already done the work up front.
100%.
This is so good. I'm just taking little notes over here because, I want people to really be able to understand the significance of what you're saying here. Startup life isn't bad. You just have to know what you're getting into.
You do. An amazing leader in the startup space connected me with another person in a particular space, and I've ended up working with their team some, just as like a really learning on both sides, learning about how you build advanced practice teams. And there seems to be a myth, Brandy, that particular clinical entities do not qualify for equity. And so I actually took the job I'm in now and did not truly start gaining equity till a year in and have my 1-year cliff. So if I can give any advisement, it's that I learned the hard way. Thankfully, there was a lot of advocating that we would get equity from the leaders, and I'm very grateful for that. But I also would say do your research if someone tells you you cannot qualify for equity as a clinical person, because that is not entirely true. And there are many people under that impression who I think are missing out. So that's an interesting little tidbit that I learned the hard way.
Thank you for sharing that. I really appreciate that. And I'm going to put some of these tidbits in the show notes so people will understand what they are getting ready to hear in this episode. But what do you think would make healthcare safer for our patients and more sustainable for our colleagues?
I really think about patient autonomy in the most reasonable ways as a way to be safer. And I've been thinking about this question for a while. You've inspired me from getting to know you, Brandy, about safety. And one thing I see a lot, because I am still so deep in patient care, is how do we better equip people across generations, across cultural differences, across socioeconomic status, that they feel empowered to better speak up, be it about their medication regimen that they don't really feel like they understand and no one's taking time to talk with them, or about a procedure they're about to have. And so if we could only inject everyone with self-efficacy, but there's so many more layers to that. But one of my personal goals is that I would be better at instilling confidence and knowledge to people so that they themselves actually know what's going on with their body. And that allows them to be safer, because I think that's a big gap in our healthcare system.
I love that you said that, because this part, the patient advocacy or advocating for themselves, has not been something that we've talked a lot about on this podcast. So I'm so grateful that you brought it up. And one thing I think about is in healthcare, how at the bedside, clinicians are seeing more and more patients in a shorter time span or in that day. And so to your point, how do you as a clinician, someone who is actively seeing patients, bridge the gap between I want to empower this patient, I want to give them all of these resources, all this information so that they can advocate for themselves, and the time constraints that you have during your day?
That's $1 million question. I think of it as almost like, what is one starfish I can put back in the ocean? So for me, I have tried to boil the ocean, and now I'm like putting the starfish in. So a lot of times it'll be when somebody tells me they're on like a glucagon, like peptide 1, like, oh, I'm on insulin, but it's called Ozempic. I will take that moment and say, thank you, John Doe or Jane Doe or they Doe, for sharing with me that you're on insulin. I want to share with you, this is actually a medication and it works this way. So I've decided that my small contributions are having a talk that ideally is not top down, is more shared decision making with one nugget that can give them something to look to or to understand, so that when something else comes up, they have a little bit more understanding of their body, which can help keep them safe there, I think.
Yeah, because I think a lot of patients, a lot of humans take what their practitioner says at face value, and they're taking this medication or they're doing this thing and they don't even understand why or what it is or what the side effects are or what the alternatives are. And then they go to this other provider and they can explain, oh, Dr. Smith put me on this particular medication because of blah, 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 and this is how it's affecting me and this is how it's helping me. Like, I don't know that the consumer understands it to that level.
I would agree. Yeah.
And to your point with patient autonomy, patients having those tools so that they can have those conversations and know, yes, Dr. Smith and I tried that medication on me and it didn't work for this reason. These are the reactions I have. It's going to keep them safe.
Exactly.
They can put the 2 and 2 together. This is what this is for. This is how my body responded to it. And this is what I want or don't want moving forward for this reason. Then it helps the next provider, the next practitioner be able to take that into consideration with their care plan.
Yeah, 100%.
This is such good food for thought. And you've got me thinking about it too, because, there's such lack of health literacy in terms of, we use all these words and all these things that we expect people to know or to understand. And that's just not realistic.
It isn't. And we're so technological, but I often worry that we don't think about the end user. And I've been so deeply convicted of that in working in tech, to be honest, that it's like people like aligning on where things are versus where they think they are is just, it's incredibly important.
And that's why some of these startups and health tech startups need a clinician there, right? Because you have to have that voice of understanding about anatomy and physiology and being with patients and how is this really going to affect that end user more so than just the technical side of it.
So much so. and that lived experience. I mean, I think it's one of those internal struggles I'll always have is thinking of the end user versus, it's a lot like shared decision making versus a top-down approach. It takes time and it takes thoughtfulness. It's not always expedient, but it's important to do the good work and do the right work. Is to really care deeply for people and helping them in the smallest of ways that add up over time, I think.
You are absolutely right. It is very important. Do you have any parting words for the audience?
Well, I would like to say thank you to you, Brandy. And I would say if you are considering a move and feel unsure or scared, that is incredibly normal. But I do think sometimes taking the risk when it's doable is very rewarding. And and I would just say keep fighting the good fight. There's a lot of amazing clinical people out there kind of looking for the next thing. So thanks, Brandy. And I'm always happy to connect on LinkedIn or private message anytime if somebody wants to reach out individually.
Awesome. So I will link to your LinkedIn in the show notes for people to reach out to you. I really, really appreciate you, Hannah, for taking the time to be on this podcast, for sharing your journey and for sharing your words of wisdom about startup. I think it's going to be super helpful to my audience. So I really appreciate you.
Thank you. And thanks for having me.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.